Well, Oxfam, a global movement of people fighting inequality to end poverty and injustice, says the economic impact of the coronavirus pandemic has deepened inequality. In its latest report, The Inequality Virus, Oxfam says it will take just 9 months for the rich to recover losses incurred during the pandemic, while it will take the world's poorest people more than a decade to get back to pre-pandemic levels. For more on this report, we're joined by Mthandazo Ndlovu, who is Oxfam's Democracy, Governance and Strategic Alliances Program Manager. Mthandazo, good evening, and thank you so much for your time. Now, of course, those are very concerning figures in terms of the recovery rate when it comes to the pandemic. But when we talk about the world's rich, who is included in that?
Thank you so much, Kathy. Well, amongst the include Bezos, Mike Zuckerberg, Bill Gates, amongst others, but all the 10 are men. But if you were to expand the list and maybe go to 15, you'll find that 4 of South Africa's richest billionaires, that include the Oppenheimer family, the Motsepes, have also made significant gains and profits during the last 9 months between March and December of 2020. So it is not an ought to be, but it is a reality that they have been able to accumulate resources just above 540 billion US dollars, or half a trillion. And that, of course, if you compare it with the reality that the world may need between 70 and 170 billion US dollars to acquire vaccine for the entirety of the population, even if you were to plan based on the single dose or double dose, you can imagine what this fortune that they've been accumulated by the richest guys could do, but they didn't accumulate it in a way that we think is fair and justifiable. It is because of the systems and the rules that have been in existence that favor them. There is tax leakages. Some of them do not pay their fair share of tax, as also evidenced through a number of researches that we've done, that also Thabo Mbeki Foundation has done through the cooperation with UNECA.
Now, one of the things that you're also raising is that around gender, because you've used, I don't know, the complete metrics that you're basing it on, whether it's the world's 20 or 50 richest people, but you've also made the point that none of these people are women, and therefore, the impact of this pandemic becomes quite gendered as well.
Certainly, at an impact level, we see that there is less women with such enormous amount of resources. But even at an ordinary people level, the impacts of COVID lockdown or the impacts of the pandemic are severely felt by women who are mostly in the informal sector. They are found as domestic workers. They are our mothers, they are our sisters, our grandmothers, our aunties. Of course, also in the informal segments, where we are also starting to see a scary trend of rise in urban hunger and food insecurity. The reality, Kate, is that only 5 multinational corporations in South Africa control over 60% of the food market value chain. And the rules are quite unfair. And we're saying, even for the pharmaceutical companies, why are they really advancing this non-disclosure rule when the world is facing this magnitude of a crisis? Even our governments, they seem to be absent landlords. They can't even disclose what will be the cost and that is associated with the acquisition of the COVID vaccine. It is very unfortunate. And of course, the levels of accumulations are just immoral and unacceptable.
So, Mthandazo, if I'm hearing you correctly, we went into this pandemic with very high levels of inequality. We're going to come out of it, and that gap is going to have widened much further. What do you want to see happen as Oxfam?
I think the world needs more cooperation and coordination amongst various stakeholders more urgently now. And I think we must start with also including inequality indicators to be part of the development indicators that are quantifiable and measurable, not only to base progress based on the nation's GDP. Much more needs to be done fundamentally to introduce social protection mechanisms. Yes, the ones that the governments have implemented and proposed during the lockdown measures are welcome, but they remain insufficient. The food poverty line is around 581 or so, and then the government was distributing 350. Much more needs to be done. There could be introduction of a basic income grant. So that conversation is quite important to happen right now. And of course, at a structural level, really investing and ensuring that women do access productive assets, and also there is fair compensation for equal pay, for equal work, so that we close the gender pay gap. I mean, maybe just to also pick on what some of your reports were highlighting, for instance, the inequalities that are found in the education sector. Much more needs to be done around investing in public infrastructure, access to data in rural schools. The reality that, as we hear that Gauteng spent almost close to $500 million on sanitization, we won't believe that until we get the details of who was contracted to do the services under the Department of Education in Gauteng.
Just briefly, Mthandazo, what then is the involvement of these top earning individuals that have been at the center of your report? What contribution do you see them playing in alleviating inequality?
They must be taxed. I think the governments must introduce a wealth tax for excessive profits. And I think they should voluntarily also redistribute some of their incomes and the wealth that they've accumulated, invested in public health mechanisms. For instance, in South Africa, we still have this huge divide between the public and the private health systems. So we do challenge them to contribute significantly towards, of course, rural transformation, agrarian transformation, public health infrastructure, amongst other things that could be looked at.
Mthandazo Ndlovu, let's leave it there. He is Oxfam's Democracy, Governance and Strategic Alliances Program Manager.